Good morning, everyone. Thank you for attending this month's webinar. It's April 30th, 2025. The main topic will be year three of our webinar series. So I want to introduce myself. I am Alvin Batista. I am RDS 2 in Edam, and I will be your webinar moderator for this month. I'm part of the Managed Care Data Support section. Today's agenda will be year three of the webinar series, which also looks going forward from year three. We also have a topic on data quality, encounter data. Under that, we'll be having encounter data quality improvement and encounter data improvement program, also known as EDIP. And we'll let you guys know what next month's webinar and the date and time for that as well. Today's speakers will be Jenny Ong. She is the Managed Care Program Data Support Branch Chief, and Deborah Dixon, who is the Data Quality Branch Chief. And we have your support team, such as myself, Felicia, May, Abby, and Xiaoyan. For questions and answers for general questions, please submit your question to the WebEx chat, and please make sure that your questions are available to all participants, as I will also be monitoring the chat along with people on the webinar team. And for specific questions, please reach out to the appropriate data mailbox as instructed closer to the end of this presentation. Before we move on, today's webinar is being recorded for documentation purposes. The recorded video, script, and presentation materials will be uploaded to our data reporting and webinar series. The glossary and FAQs are also updated regularly every month. So without any further ado, our first topic will be the welcome to year three of this webinar series. And I'd like to hand it off to Jenny Ong, Chief of Managed Care Program Data Support Branch.
Thank you, Alvin. Morning, everyone. My name is Jenny. I'm the Managed Care Data Support Branch Chief. My team has been working on this webinar series for the past 2 years now, and today marks the beginning of year three. I want to thank everyone for your attendance and support in our ongoing webinar series. Thank you for making this growing from year to year. My team works on bringing content and presenters to you every month. I was part of the original data quality webinar series from 5 years ago, and I am impressed by this newly updated series where we are becoming more transparent in our data and the quality of our data. Thank you to the Managed Care Data Support section led by Amy Peterson and the team. The past few years, we have been working on dashboards to share DHCS commitment to strengthening our public reporting efforts for the various programs within the department, including the CalAIM initiative for members to receive well-rounded care. Attached is a link to our dashboards page where you could find all of our dashboards where we showcase our data. Our current goal this year is the behavioral health transformation, where we're working on revamping the performance outcomes dashboard to look into our mental health plan services for specialty, non-specialty, and substance use disorders. We will be bringing our Behavioral Health 274 team to present data quality into the webinar series as well. So there will be more information to come within the next few months about how BH will be part of data quality. For more information in our webinar, there is a link to our webpage created by my team where we do record and post these webinars every month. We also want to thank you to our data quality branch led by Debbie Dixon for their ongoing partnership to bringing new data quality updates to the group every month and being experts in their field. We look forward to bringing year three forward with them. Thank you.
So far, we don't have any questions in the chat. For people that have issues with your sound, one thing that happens to me sometimes is that it could be a laptop setting or your computer settings. It could be possibly a new computer. So just double check your sound settings on your computer as well. So other than that, I would like to move on to the next presenter. This topic will be on data quality and encounter data. I'd like to introduce Deborah Dixon, the Chief of the Data Quality Branch.
Thank you, Alvin. Good morning, everybody. Thank you for joining us today. And thank you, Jenny, for the introduction and the shout out to the Data Quality Branch. So today we're going to talk about some data quality improvement efforts that we've had ongoing and we've mentioned in the last few meetings. And keep in mind that this is specific to medical managed care plans. So as we know, we've been talking about the importance of high quality encounter data for a variety of reasons. Plans, of course, as you know, are contractually obligated to submit the complete, accurate, reasonable, and timely, the CART dimensions, if you will, on the encounter data that is received from the plans to DHCS. So our reporting standards align with the file formats that CMS and other HIPAA reporting requirements, other national requirements for our submissions from DHCS to our federal partners. We must align to those standards. So in addition to that, meeting those requirements, we use encounter data for a variety of reasons beyond just that file format and those standard whether it's claiming standards or coding standards, those are all important, but we also use that information for our population health management. What's going on? What are people using and what services are they utilizing in different geographic areas? Those kinds of analytical functions are also need some the accurate data to be able to take a look into what's happening with our populations. Audits and investigations are a part of that, of course. Quality reporting that we do from DHCS to our federal partners, and of course for capitated rate development. So very important reasons that we need high quality encounter data along with federal requirements and state requirements that we must align to as well. Next slide, please. So we're doing a few things to improve the the encounter data quality. And we've mentioned this in the past few months that we are developing an encounter data improvement program to help with those persistent encounter data quality issues, meaning a collaboration and a partnering with the plans and their providers to determine the root causes and try to figure out what it is that's happening and to fix those issues in a variety of ways, whether it's a matter of surveys or using this webinar, for example, to disseminate information and to make sure that we are aware of the challenges that our partners have and are able to work through those challenges to get the quality encounter data that we must submit to our federal partners. As a part of that, we are refreshing the quality measures for encounter data, otherwise known as QMed report. This is probably familiar to those of you on the medical managed care side. You get those QMed reports that show what the measures that are being monitored and where the encounter data quality issues are that need improvement, and to help align with those standards that we are trying to reach with our federal partners as well. Okay, next slide. So the QMed 2.0, as we are calling it, we are updating that currently. Those of you that are familiar with that report card, plans currently get this report card, and it's been static for the last 10 years or so, outlining 8 threshold measures and then some informational measures that are being used for monitoring. It hasn't been updated, and we haven't been using it to enforce quality expectations. Now, with new programs implementing and new requirements from our federal partners, we're updating that QMed to reflect some of those new requirements. In addition, in looking at what's currently going out, the scoring methodology has been simplified. We are looking at streamlining the report card so it's easier to read, it's more transparent, it's more obvious where the issues are, what's measures have been passed and failed, for example, make it easier for the plans to update and fix those data quality issues. And we're going to introduce a rules-based enforcement of those expectations so that it will not remain static as it has in the past 10 years. We will be updating more frequently using some rules-based enforcement that you'll see as part of the QMed implementation. Next slide. So here are some of the proposed measure domains that, as part of the federal reporting requirements and some of our business needs and items that have been brought forward from our federal partners and our data quality reports that come back from them from the data that we submit using the encounter data that's come from managed care plans. You can see a few different areas: timeliness, duplicates, denied encounters, NPI usage. This is just an idea of the kinds of things that are being reported and are being brought forward from our federal partners that we must align as well. So this is the type of work that we'll be doing from here forward. We'll be looking at what has been identified as encounter data issues to be improved by our federal partners. We have a monthly meeting with them. They provide a report to us showing what they see as the encounter data issues on their side. So we would align with that, and those can change over time rather than sitting in a static environment as we've done for the past 10 years. So here's some of the proposed domains, and the additional details will come out in the public comment that's happening this summer as part of the APL release. Next slide. So here's our tentative timeline. We are currently doing the internal review portion. It did start in April, and as you can see, it's going to run through August. That includes the public comment piece that the plans participate in. So get an opportunity to take a look at what the changes are and give your responses to those and be able to align before those report cards are implemented. As it stands now, once that timeline is completed, we're looking at a September release of 2.0, and the plans would receive their first 2.0 report card in September. So we'll stay on top of this and make sure that we keep reporting in this forum the progress of what's happening with this as we get closer to the dates and the progression of where we are as part of the Encounter Data Improvement Program. So thanks, back to you, Alvin.
Thank you, Debbie, and thank you, Jenny, for your presentations. So far, we don't have any questions in the chat. I know we had some sound issues, so hopefully that was taken care of. If we don't have any questions right now, just go ahead and open up in the chat if you guys want to open. Oh, actually, we have a question from Eric. If there are fewer than 95% denials, will the turnaround time be changed from informational to a pass in the new QMed? Currently, it is informational if there are fewer than 5% denials. Debbie, do you want to go ahead and take that one?
Yeah, I can't speak to the details of that at this point. What's going to be the final version. So yeah, more to come on that. We'll respond to that once we have all of the details solidified.
Thank you, Debbie, for that. And then Kim Phillips asks, when will the survey be released to the MCPs? This was mentioned in the previous month's webinar.
I'm anticipating that to around the fall timeframe as well. I know that we're knee deep in the development of the program itself and trying to get the QMed out the door. So I think once we have a look at where we end up and what's going to be measured, then we would do a survey to get some input on what the plans and providers feel is a part of their issue surrounding accurate data and where they need help.
Thank you for that. Also, if you guys have any questions in the webinar, in the chat, go ahead and unmute yourselves, and then you can go ahead and ask your question. Hearing none so far, we'll go ahead and continue on. Okay, just to give you guys actually a question just popped up from Jackie Liu. When will the technical guide for QMed 2.0 be released? Will it be before September 2025 so the plans have time to learn about the details and improve in the system?
Yeah, the two are closely related in terms of the releases the release dates. So yes, the intent is to have the detail out there. You'll see that in the APL that's coming through, what we're looking at. But the short answer is yes, you would have a chance to look at that before, so you know the details and what needs to be done on your end to improve your systems.
Thank you for that. Scott Wesolowski, what is the measurement period for the first QMed 2.0?
I'm not sure I understand what they mean by that question.
Scott, do you want to go ahead and further your question? Otherwise, we can take that back and ask this subject. Actually, Norm Decker is asking Q1 of 2026 or future.
Basically, what time period is going to be used for the first QMed 2.0? Is it like Q3 submissions, Q1 submissions?
Let me confirm.
And Ken Phillips asking, will QMed report release in September be the baseline or what's to come? It looks like that we may have to get back to you on that question. Let's see. I'm looking in the chat. Oh, something just popped up. Nope. All right. So go ahead, continue to ask your questions in the chat as we will continue. Just to give you guys a preview for the next month's webinar for May of 2025, we will focus on Medi-Cal Connect. The date will be May 25th of 2025 from 10 a.m. to 11 a.m. So we'll let you guys know through invites. And I know there was a question asking about somebody was forward the invite. Also in the chat, they responded back to you. We have a direct site where you can add your invite through our subscribe. And then if you have any other people that would like to be added, they can use that link as well. So other than that, I just want to thank our presenters, Jenny and Debbie, for their presentations today. And other than that, we want to thank you guys. And if you have any other questions, if you have any comments about the webinar series, what you like and don't like, feel free to put that in the email box provided, mcedss@dhcs.ca.gov. Other than that, thank you guys, and we will see you next month.